Families will get better access to health and wellness services under a major new action plan that puts mothers and children front and centre. The Health Ministry has announced a slate of nearly 50 new initiatives that support couples and parents, children and adolescents. They include a one-stop wellness hub for families in the East. Bahajjaj with this report for us.
Hi, you can build.
This new Family Nexus Wellness Hub at Tampines Hub brings health and wellness closer to home. The pilot began in November, offering programs and services for children and parents living in the vicinity.
I feel it's someone holding my hand in my parenthood because me and my husband, our family is all in overseas. So when something we're not sure, we don't know who look for. But with that support, we feel that there's always someone behind us, support us.
Officially launched on Friday, it is one of Singapore's 4 one-stop wellness hubs in the country, and the first one situated within a community rather than at polyclinics.
I think the important is we go where the families are. So by being situated in a very convenient location, the families may, they may see this place and say, why not I give it a try?
The Family Nexus is part of a larger strategy based on recommendations from what's known as the Child and Maternal Health and Wellbeing Task Force. The intent is to help drive better health outcomes for children and their families and overcome new challenges in this age of parenting.
Just like access to education and gainful employment and shelter, health is fundamental to the well-being of a family. We want to help families to live happy and healthy lives. To enable this, we need a strong scaffold for children and their families at every stage of life, so that children have a good start in leading healthier lives from young and can maximize their potential.
The action plan includes 48 initiatives, from helping couples navigate pregnancy and parenthood to nurturing happy homes and healthy children and adolescents. They also cover the delivery of services to the family as a unit, including a model that enables mothers and children to access healthcare together and receive services relevant to them in the same visit.
For instance, while the child is scheduled for his routine vaccinations, the mom too can receive lactation support services and be screened for postnatal depression to ensure that both mom and child are well. And I'm glad to share that this service is now available in 19 polyclinics across Singapore, ahead of our initial target of 14 by 2025.
The plan builds on existing efforts to integrate health and social services and ensure access and more tailored support to those from vulnerable and at-risk groups. The Health Ministry says more than half of the 48 initiatives are already running. The rest will be implemented over the next 2 years.
And for more on how this strategy is being implemented on the ground, we're joined by Associate Professor Su Lin Lin, and she's Head and Senior Consultant of the Division of Maternal Fetal Medicine at the National University Hospital. And also joining us, Adjunct Associate Professor Chong Shang Chi. She's Head and Senior Consultant of the Division of Developmental and Behavioral Pediatrics at Kutikpot, National University Children's Medical Institute. Thanks so much, ladies, for joining us this evening. Let's start with Professor Chong. We just heard my colleague Muhammad there telling us these 50 new initiatives. I take it we have initiatives because times, they are a-changing.
Yes.
Challenges, new challenges, the family dynamics, that's changing as well. Online, offline, all these things. Now, the task force, if you could sum up 50 new initiatives, what are they planning to address that is new to this age?
Yes, I think that there are so many initiatives because what we're trying to address is to relook at the way services are delivered. It's not a single organization or a single stakeholder which is doing the work that's supposed to support mothers and children. A lot of things that we discuss are actually cross-cutting or cross-functional issues, and this actually led to so much dialogue, engagement, thinking thought leadership that was put into this to implement and drive the community towards these efforts. I would think that this is a really courageous effort. I think it took a lot of time and it took a lot of the investment. The government was so invested to make it work. And then we have so many people coming together to put together programs. Some of these were pilot programs, and we are evaluating if they were impactful and meaningful. Some of them were not new. For example, I give you an example. We have always been screening mothers for perinatal depression in the obstetric wards and in the clinics. But to bring it out into the community and the primary care meant that we wanted more mothers to benefit from this. And then the kids were coming for vaccinations, the infants. Mothers will be opportunistically screened for maternal mental health as well as gestational diabetes.
All right, this is perfect time to bring you in, Professor Su. Now, your specialty is in maternal fetal medicine.
Yes.
So when she talks about cross-cutting, actually there are many aspects to family wellness or family health. Arguably, you could say you are at the very starting point of a family, if one can define a family as the birth of a child to a couple.
Yes.
How do you see this strategy helping you in your particular specialty, so maternal fetal health?
Sure. Yeah. So you're right. I think as obstetricians, we have the privilege to help the pregnant women at the very start of their journey. So I would say that in Singapore, we have the capability to provide good antenatal care for our pregnant women. For example, we have high-risk pregnancy clinics. They help to look after pregnant women with various medical conditions, from diabetes, heart problems, to cancers. The conditions which in the past may deem them unsuitable or unsafe to undergo pregnancy, but now they can go through pregnancy quite smoothly. We have fetal medicine clinic help to look after the unborn babies and have a plan that is already in place before they are even born.
So these new initiatives,
Yes.
do they include what you're talking about? Do they bring new angles to this? Do they, I suppose, enhance it, expand it in any way?
Yeah.
Prof. Chong?
Yeah, I think that what we're looking at is more a real population-based, a broad-based approach, and then customized approaches for specific risk populations and specific groups who have been missed previously. A very interesting thing would be, for example, even fathers. The role of fathers in the early years of the infant and child and caregiving has now suddenly been pushed to the forefront, and the roles are now being established as very important. And within these years of the implementation of the strategy plans, we have actually adjusted the paternal leave for fathers. And I think coming to Prof. Su Lin's examples of high-risk pregnancies, we are having fewer babies. All the babies we have are precious. So some are healthy, some are higher risk. But from a population approach to a customized approach, we do not want to have any gaps. We want to address a lot of the families who are also at risk, for example, the low income or the vulnerable ones, and then the ones who are mothers who are at risk as well or in poor health, so that the babies come out, they could be as healthy as possible. Yeah,
I think an important another strategy that we are pushing forward is really bringing the antenatal education program into the community. Because what we want to do is to really emphasize that in majority of the cases, pregnancy is actually a normal physiological process, and we want our pregnant ladies to enjoy the pregnancy. So we feel that by empowering them with the knowledge that is provided in the antenatal education program, they will provide them more confidence and make them feel more supported in their pregnancy journeys.
But I presume the support extends beyond the purely physiological. In any case, the influence, the two-way impact on mental health and physical health,
exactly.
that is well known. So how much support does this new initiative offer, or these 50 new initiatives?
I think that if you pocket them into special groups to look at, first is the knowledge and the awareness of child health and maternal health issues. This has been really looked at the task force. In fact, we came up with guidance on screen use in children, healthy eating, sleep, as well as nutrition. And among these 4 priority topics, for example, identified for children, we really looked and crystallized all the evidence and the good guidance. We pushed it to parents, and now we are trying to disseminate them in a one-stop health hub app, for example. Yeah. From the services point of view, I think the impact will be felt if all the agencies come on board and are aligned to some of these strategic directions and are able to implement it consistently.
What agencies might these be?
These could be preschools. A lot of them, for example, in the newer ones about eating disorders in adolescents, they are looking at secondary schools or early secondary schools. Other touch points would be the Family Nexus that Minister Masagos has announced, and also polyclinics, primary care. And also, I think in the social service agencies and the family service centres, after we align and crystallize the knowledge, all these stakeholders will come together and say, okay, these are the things that we need to implement in the community for the good of our mothers and children. Let's do it together and in an aligned manner. And hopefully these little pockets will add up to bigger impacts. So it's like small little moments of touch points with parents, cumulatively a bigger impact.
Okay, final question. I'll keep this short and it's a little bit out of the box. It's families. So families are not just young children and mothers. So they include a growing number of permanently childless people like myself. What do these initiatives offer for someone like me, headed into, I suppose, senility with no children to speak of? Very quickly, Prof. Chong and then Prof. Su. What do the initiatives offer?
Lily,
this part of the family.
Yeah. Okay, maybe I'll go first. I think that we shouldn't look at mothers and children as existing within families only with children. I think that everybody has a part to play in the child and maternal health efforts of our country. I give you examples. We were really talking at the task force about employers being empathetic and sympathetic. I don't know about yourself. Maybe you can be looking after nephews and nieces. And, one of the nicer things to do will not be taking out the screens and saying, okay, auntie cannot play with you, but, you just look at the screens for a very long time. But what we are saying is that I think the broader initiatives that we are coming up with should have impact as an awareness and a social movement. And a movement towards awareness of health for mothers and children and families.
Very quick answer from you.
Yeah, so I think maybe from my point of view, I would think that providing support to people around you, the colleagues, we have many pregnant ladies who are very stressed because of their workplace. So support from colleagues will be, will provide them a good form of relief.
All right. Thanks so much for joining us this evening, ladies. Associate Professor Su Lin from the National University Hospital and Adjunct Associate Professor Chong Shang-Chi from Khoo Teck Puat National University Children's Medical Institute. Thanks so much for coming in this evening.
Thank you for having us.
Thank you for having us.
Yeah.